Good evening. I'm Kelly Ripken, National Chair of A Women's Journey. On behalf of Johns Hopkins Medicine's A Women's Journey, thank you for joining us this evening for our monthly webcast series, Healthy Conversations That Matter. A Women's Journey always strives to improve your well-being through health education. Many of us live with some sense of regret, which can be a powerful emotion that can impact your mental health. However, as we will hear this evening, there is the opportunity to reframe regret as a catalyst for positive change and personal growth. Tonight, we are joined by psychiatrist Dr. Karen Swartz, who is professor of psychiatry and behavioral sciences and the Meyer S. Meyer Professor of Mood Disorders at Johns Hopkins Medicine. So please use your Q&A on your screen to ask your questions. Our webcast will conclude at 8 p.m. this evening. I want to take this opportunity to acknowledge and thank Johns Hopkins University's program, Hopkins at Home, for their production assistance, and you can visit their website for additional lectures and courses throughout the year. And now I am pleased to welcome Dr. Swartz. Hello, good evening.
Thank you, Kelly. So regret, that's a complex emotion that we have all experienced. Some regret things they've done, at times because of consequences for themselves, at other times because of consequences for others. Some regret things they did not do and worry about missed opportunities. Regret is about the thing you wish you never said to your sister, the job you wish you took, the relationship you still think about. Regret's an intense, upsetting, negative emotion that's not easily forgotten. Feelings of regret may last for minutes, or days, or weeks, or even years. So, what are some of the characteristics of regret? Well, first, it focuses on the past. It's a negative, painful emotion, and it focuses on the person and choices the person's made. And it leads to making comparisons, where you are more often in the negative group in those comparisons. And then finally, it very frequently leads to self-blame. With regret, you're focusing on what you could have done differently. Different decision, a different course of action, with the idea that that would have led to a better outcome. We don't regret our good decisions. We don't regret the things that turn out really well. You aren't just wishing that things had turned out differently. You're likely feeling guilty and blaming yourself for how things went when you have a sense of regret. So researchers have described two ways to characterize regret: an action path and an inaction path. These involve either regretting things we did versus things we did not do. The research in this area shows that action-related regrets typically allow people to learn from their mistakes and move on. They don't stick with you in the same way. There's typically a shorter duration of negative feelings associated with that type of regret. I did this thing I wish I hadn't. Okay, I won't do it again, move on. The regrets related to the inaction plan, the missed opportunity, the something you never said, the something you didn't do, the challenge you didn't take on, those are much harder to get over. The negative ruminations that are associated with inaction are much more strongly associated with anxiety, depression, and ruminating about what might have been. As a psychiatrist, I have the privilege of talking to people about some of their most private thoughts and experiences. Regret is a very common theme, and people spend an enormous amount of time thinking about their regrets. This is not constructive, and it's even destructive at times. It's very common when I'm meeting with someone professionally to urge them to minimize regrets when they're thinking about options for themselves in the future. When they're thinking about a major decision, I ask them to spend extra time thinking about how much they will regret either doing something or not doing something, and to really think that through and take it down the path. As you can imagine, The regrets that stick with people are not about trivial things. Most people quickly move past something trivial, like, I regret that I didn't tell anyone I used up the milk, or I regret I snuck in to take the last parking spot. These are small things you don't think about for a minute. The regrets that are most powerful relate to the relationships that mean the most to us. They often involve choices about where and how we spend time and what we prioritize in our life. Research has identified the most common regrets, and they are in the areas of education, career, romance, parenting, and the self, things you've done for yourself. This research has also found that people are more likely to regret inaction rather than action. So that action path, inaction path. And this is likely because inaction, or what we haven't done, lead to imagining what might have been. As opposed to dealing with the consequences of perhaps a bad decision, there's a lot of time in that sense of, oh, this could have worked out well if I had just. We deal with the decisions we make and the outcomes, both good and bad, much more easily. It's that road not taken that may seem to be filled with wasted opportunities and that really stick with people. So this regret of missed opportunities seems to be stronger and longer lasting than the other. It's a constant struggle for many people with demanding careers to decide if work responsibilities or family responsibilities will win out. The average person does this well. The person who can do this well clearly has figured out some kind of balance in their life. Sometimes work responsibilities have to take precedent because you're in a critical period at work. You're going to regret having missed an important deadline, or not getting to a meeting that was really central to your job. But what people discuss is regrets that they didn't make their families a higher priority. And it's not so much the major events like being home for major holidays or someone's major birthdays, but rather finding time for their parents or children for these smaller activities. I hear people regret that they didn't make more time to attend the soccer games and help with homework, or simply listen to what's going on in their children's lives when they were young and at home. Similarly, as parents age, I hear a lot of regrets that people were so preoccupied with their careers that they didn't make time to spend with their aging parents and to hear and really remember the family stories from their parents, or just knowing what's going on in their lives day to day. Some people regret things they have not done and the opportunities missed because they were anxious about taking action. And this lack of confidence and this not believing that they can succeed can lead to a belief that it'd be better just not to try. And that's where being a more anxious person, or perhaps having anxiety issues not addressed, can worsen regret or put you at risk of more regret. So whether the regret is for something you've done or failed to do, it remains a powerful negative emotion that can have negative consequences for your health. I'd like to share an example of where regret helped me change my behavior in a positive way at work. When I was a very young attending, honestly, very young, 20 years ago, I remember having a very challenging interaction with colleagues. We were taking care of someone, and there were several reasonable treatment options for the patient, but I was disagreeing with my colleagues about the best next steps. And the decision we were making was more complex because there were, honestly, several safe options. I then had an unplanned, truly unplanned in the hallway interaction with the nurse manager of our inpatient unit. We were quite frustrated with each other. We did not agree at all on what the best next step was. And quite uncharacteristically, I found myself getting angry and drawn into a very heated discussion. We all know that's never productive, and we devolved into the least productive form of communication, where the two of us were all but yelling at each other. Now, as someone who prides herself on remaining professional, I could not believe that I was baited into this kind of interaction. I think it's important to be professional and calm, and behaving in such an atypical manner was really upsetting to me. Now, further regret came when this person inaccurately, well, at least in my estimation, very inaccurately, shared his version of our conversation with my other colleagues. And that's where there was fallout. My colleagues were upset I hadn't spoken to them directly. I regretted not speaking to them directly prior to this unproductive conversation. And I regretted the way that I interacted with him. And so I said, I have to do something to move forward. It has been my experience that a genuine apology is an important first step in moving past something you've done that you regret. I sought out my 3 senior colleagues who are at the center of the "you didn't talk to us" problem, and I apologized to each of them for not speaking to them first. We were then able to have productive conversations and talked about options, and without the heat of emotions, we came to a consensus about the best thing to do. But probably more importantly, I made a promise that I would speak to them directly in the future, and that they were free to call and check if there was ever an implication that I had spoken to this other person first. I think both my apology and offering a plan for our improved communication going forward went a long way in helping us do that. I think about that interaction when I'm in a meeting and I am tempted to lose my cool. It's not productive. And I think that very unpleasant interaction has had a very positive effect on me for years and years. So I think that that's changed my functioning. That was one because there wasn't any bad fallout in an important way. Nothing bad happened that couldn't be fixed with an apology. I view that as the kind of thing where regret can actually move you forward and get you to be in a better place. But moving past regrets involves taking responsibility for what happened, expressing remorse for your actions, and taking action to make amends. And changing your behavior is critical if you're going to improve or repair relationships. Knowing how to apologize is a really important skill that we all need. The first step of apologizing is to acknowledge to the person that you have done something that you regret and taking responsibility for it. It's actually a very important part of apologizing to be able to discuss your understanding of how your actions hurt or upset that person. That element of empathy, empathy is putting yourself in someone else's shoes, having a sense of what they're feeling. Empathy is critical because without it, the other person might not believe that you really understand what you did and how that made them feel. You also need to take action to make amends if possible. But as I mentioned before, perhaps the most important thing you need to do is to change your behavior in the future. I have a close friend who is terrible at acknowledging when he's done something wrong and does not apologize. I've known him for 30 years. I've never known him to apologize. But he's actually decent at thinking about what happened if others are upset with him and changing his behavior. And while an acknowledgement and an apology would be more helpful and would be very welcome, to me, it's more important that he actually changes his behavior. I don't want to receive flowery, detailed apologies that feel meaningless if the person's doing the same regrettable behavior over and over again. A psychologist, Daniel Pink, wrote a book, The Power of Regret. And he talked about this sort of "I have no regrets" culture where people say, nothing I do would cause me to feel regret. And he talks about the fact that regrets are a very normal part of life and actually may be valuable. It's a source of information that might motivate someone and inspire someone to make more thoughtful choices in the future. I certainly think that. I think we learn a lot from our mistakes. And as I'll talk about in a moment, it's part of being human that you say, I'm not going to get it right every time, but I'm going to try to do better in the future. So there are a couple strategies for managing regret that I'll talk about. The first one I'm going to talk about is a 4-step process. The first is that you accept the fact that you are feeling these negative emotions. I'm regretting something. I'm feeling something that's unpleasant. The second is that you have to determine why you're feeling them. What did I do? What didn't I do that has me so upset? Third, you find a way to learn from the experience. I'm really disappointed I didn't take that opportunity, or I should never speak to my sister that way. And then fourth, you try to let go of the negative emotion and move past them. It's really a process of forgiving yourself that allows you to move past feelings of regret. Many of the elements of self-compassion help with this. They include saying things to yourself like, I'm doing the best I can. I want to learn from my experience. I wasn't trying to make it difficult for anyone. I wasn't trying to hurt anyone. I just made a mistake. As opposed to, I'm a terrible person. I can't believe I did that. No one should ever forgive me. Often, I think we have a harder time forgiving ourselves than we have forgiving other people. There's another technique that's helpful, which is cognitive restructuring. This is a form of cognitive behavioral therapy. And the whole idea behind CBT is that you examine your thoughts and then you might challenge negative thoughts. The basic concept for cognitive behavioral therapy, or CBT, is that our thoughts, our feelings, and our behavior all influence each other. And so if you're ruminating and having negative thoughts of regret that are very strong and might even be negatively impacting your functioning, and changing, these negative feelings and pushing you towards, say, anxiety or depression, then you want to learn to challenge those thoughts. So I'm a terrible person for having done this thing. You would challenge it with, I wasn't trying to hurt anyone. I was really just trying to do my best. I made a mistake. Challenging thoughts can actually lead to changing your feelings and changing your behavior. So that's the idea, that you take on the thoughts and actually work with them. There's another psychological approach which focuses on forgiveness, which can be very helpful for managing regrets as well. This is called the REACH model, and it has the 5 following steps. The first word is slightly contrived to make sure it spells reach. So, number 1, recall the hurt. So face it, I did something, I'm upset. The next step is to empathize, which is being empathic for yourself. Be kind and compassionate with yourself. The third is to altruistically offer forgiveness. Again, forgive yourself. The fourth is to commit publicly. This is an important part of forgiveness work and working on regret, that you share your thoughts with someone about what happened. That could be a close friend, that could be a counselor, that could be someone from your religious community. It certainly does not need to be someone that's professionally trained. And then fifth, you hold on to the feelings of forgiveness and you stay true to the decision. I am going to forgive myself. I am not going to spend all day thinking about this. When those thoughts come in my mind, I'm going to challenge them and try to push them away. Forgiving yourself is always a deliberate choice, the same way that forgiving someone else is a deliberate choice. And when you make that choice, you're saying, I want to let go of this anger and resentment and disappointment that you have focused on yourself. It really involves treating yourself the same kindness you would show others. So research into this approach, this 5-step approach, showed that after working with a trained professional for 6 hours, there were clear positive outcomes. And that's similar to the work that's been done with forgiveness, that learning a method and feeling that you have skills to take it on is part of it too. So you just don't get overwhelmed by these negative feelings. Medical problems can also change how we experience regret. As someone who works with patients who have mood disorders, so depression and bipolar disorder, I know that when people are depressed, they have many more negative thoughts, as well as changes in their ability to enjoy activities, changes in physical symptoms like sleep, appetite, or energy, and very importantly, changes in how they feel about themselves. We call that a self-attitude change, where it's part of depression to be critical of yourself. So it's a very common experience during depression to have cognitive distortions where negative thoughts are magnified and very small worries feel overwhelming. So with depression, usually people will really be focused and dwell on negative thoughts and past mistakes. So in the midst of a serious depressive episode, many people have trouble thinking of anything but aspects of their life that they regret. An inability to move past the regrets despite trying to, or having incredibly intense regrets that are extremely painful. They might be an indication that someone is suffering from depression because the intensity of the experience is more than you would expect. There are also potential physical consequences of regret, which include increased stress levels, changes in hormone levels, and changes in immune function. And multiple studies have shown that muscle tension, sleep disturbances, and changes in appetite, as well as muscle pain, joint pain, and headaches are associated with high levels of regret. And as I mentioned earlier, regret may also lead to increased anxiety and depressive symptoms, and sometimes can even trigger a depressive episode or anxiety disorder in someone who's vulnerable to that. They've also done imaging studies of the brain where they show there are certain areas of the brain, specifically the medial orbitofrontal cortex, which lights up, that shows that that's active when someone is thinking about something they regret. So we know that this is not simply a feeling, it also has relationship to the body and can trigger certain changes in the body. So the experiences we regret, I see as opportunities to learn, and we need to think about what we regret and think, when I face something that is similar to that in the future, I am going to handle it differently. I have one last thought about regret before we begin our conversation, and that is that it is really important to take time if you're going to make major decisions. Get as much information as possible so that hopefully you're able to minimize regrets. We often feel pressure to decide things quickly, but with major decisions, a little extra time is often what is most important. And get advice from the people that you trust most. And we need to maybe all slow down a little bit. That ends up being healthy for us.
Thank you, Dr. Swartz. True words. That was really enlightening, I tell you. We've got a lot of questions. So should we just jump into it, you
Sure.
think? Why not? Okay. So the first question is from Gail, and she would like to know, what does one do when the person to whom they want to apologize is no longer alive?
That comes up if you work with individuals, anyone that's worked in a 12-step program or worked with people that are doing a 12-step program, they'll talk about making amends. And I think what I've learned from my patients going through that is sometimes you can't meet with the person, it's not practical, or they've been lost, but you could write them a letter. I think formally thinking it through and saying, this is what I want to tell you or what I wish I told you. Because again, you're going to have other relationships in the future. Maybe not if it's a parent that's exactly the same, but that same, I didn't express my feelings, or I held on to being angry too long, or I should have just let it go. I think writing the person a letter is sometimes a helpful thing to do.
Thank you. I think it's nice too to sort of get it out of your head.
You put it somewhere, right?
Yeah.
That the problem with regret is it's stuck and spinning and so negative. And so sometimes that's why talking to someone is helpful. I mean, I'm a
Right.
psychiatrist. Of course, I think talking to someone is helpful. I always think talking to
What
someone
are
is
you
helpful.
talking about? Yeah.
But it could be your best friend. It could be your minister. It could be someone who you trust to keep your confidence. That's actually very important. But, because often you'll hear you through and they'll say, I think you did your best. Why are you being so hard on yourself?
Right.
Because
Right.
you lose perspective, right? You completely lose perspective of how bad it was.
Yeah. Yeah. Well, you keep ruminating, you're going on and on.
Well,
and
and
on
this
in your head.
excellent question, you've lost someone. Say it's someone you can't speak to them. Then
Yeah.
it turns into, I regret what I did, and I so regret we never talked about it, and now I never can. And then it just, it gets bigger and bigger and has more negative consequences with time.
So on that note, there's a question coming in from Rachel. So on the note, when it becomes bigger and you ruminate, you can't get to the regret part for whatever reason, and it keeps just spinning around, and then you're going down that very bad rabbit hole. So her question is, so how do you get out of that? What if you can't get out of that rabbit hole?
Well, again, I'm going to be biased because I'm a psychiatrist who focuses on depression. But if you really can't get out, you should probably speak to someone. It could be your primary care doctor, just to say, do you think I'm going through a depression? Because most people can. Most people don't get so stuck that they're not able to. Now, that having intense regrets doesn't mean you have depression. I'm not trying to say that. But if you've done some of the other things we were talking about, if you've talked to someone, if you've thought about how you can make amends, if you've tried to give yourself permission to stop thinking about this all the time, if you've tried to have some compassion, you're saying to yourself, I did my best. I'm sorry that I did this. I'm going to do better in the future. That is pretty helpful for a lot of people. So if you really are stuck, it might be good to at least get an objective view about whether, with depression, small triggers generate giant responses. So if the regret is this big and it shouldn't be, I do worry that sometimes depression's going on.
So what happens if you regret and you apologize and you go through, the
You try to do what you should do.
But then it comes back. You know how you do regrets and you say,
Absolutely. You think about it again.
There's a trigger or there's something, and then it comes back. So what does that mean? So when that
I think that means you're human. Because the point is that we all have the things that if we had a crystal ball, we'd do it differently. We would have gone this path, not that. But it's really how long it stays with you. To say it never comes back, that'd be, you don't get to put it in a box and put it away. But is it out every day? Is it in your face every day? Can you think about nothing else all the time? That's more worrisome to me. Because then when it comes back, you do the same process. And it often comes back when there's a trigger, a similar decision to be made, a similar interaction.
Mm-hmm. It sounds like, it could be very close, and I think it would be very hard to figure this out. Regret, anxiety, depression, right? How does a person determine, let's say, like you just mentioned, they can't let this regret go, or they did, it's back. Now they can't stop thinking about it.
Sure. So then, having a negative thought you can't get rid of could be depression, anxiety. But the thing about those medical problems is there are other symptoms that go along with it. So if I'm working with someone, I'm trying to determine, gosh, has this intense experience triggered a depression? I'm asking a lot of other questions, as your primary care doctor would or a therapist might, about how are you functioning in other ways? How are you getting along with other people in your life? What's your sleep like? What's your energy like? What's your focus like? If you're at work and something's before you, you're supposed to do, are you able to do it when you have the pressure of, well, I got to get this done, so let me take care of that? Are you able to take care of your family? And so we ask about a lot of other things. So it's not that you just say one individual thought, feeling, or symptom doesn't mean you have depression or anxiety, but it's learning about what else is going on. An analogy I use all the time when I work with the high schools with our ADAP program is, you know, it's still asthma if you visit your friend with 3 cats and it triggered it off, right? Because I don't have asthma, I'm lucky. So I can go see someone with 42 cats. I'm not going to have an asthma attack because I don't have asthma. We have different biological vulnerabilities. So some person might regret and they'd be very angry, very frustrated, but they would never have depression or anxiety because they don't happen to be vulnerable to getting those. They just are living with a lot of negative emotions. Now, that's not going to do anything good for your stress level, and that's not going to do anything good for your blood pressure. That, there are other medical consequences.
And is it possible too that with the regret, and you kind of get the triggers that flip around, maybe you need to look at the environment you're in, perhaps, that the trigger happens to be right there in your face, and maybe there is something that you recognize it and you realize, okay, I need to basically remove this. I'm simplifying, but I think what
you remove a trigger, or you say, gosh, if I talk to my family member about this topic, it's never going to go well.
Yeah,
so
exactly.
I'm going to put energy to make sure we don't talk about that. There are all these things like that is too much of a hot button issue for the two of us. And it might be, those are usually things with siblings, to be honest. And those things you're like, we just can't talk about it. It'll go better if we don't. And we don't need to, right? We don't have to bring 50 years of feelings about this into every conversation we have.
Yeah. Waste of energy.
It is. And then all your interactions with that person are so tense that you don't enjoy them. And so that's wasted opportunity too, to be able to enjoy that relationship.
You're almost wasting opportunities to be making wonderful, new, beautiful memories.
Yes.
Right? If you're constantly back here,
Well, the whole past, future, there are the people that focus, I've talked at different women's journey programs about introverts and extroverts, but introverts worry about the past and worry about the future. And the extroverts, I don't understand them because I'm not one of them, but the extroverts are living in the moment. Well, okay, if you're an introvert, you're going to be caught up on these regrets. If you're an extrovert, people around you might be annoyed with you and you're not even aware because you're like, what are you upset about? I don't understand why you're upset. So that can lead to conflict.
Right.
And so they might regret the conflict, but they don't quite get, what are you fussing about? I don't quite understand that.
So therefore leads us to our next question from Katia. So how does this affect relationships? If in this case, this is someone who, they're married. And so here you are constantly. Yeah.
So this is the main reason to work on regret. And I would say to work on forgiveness too, right? What the key thing in all this to remember is you're both going to do things you regret. Each of us focuses on what we regret having happened to us more than we regret what we've done to others, right? And it's that whole thing. Apologize, model the behavior, forgive. You're going to need to be forgiven at some point. And I do think that, there are no relationships that I've ever experienced in any aspects of my life, including as a psychiatrist, where you aren't frustrated with the other person. And the more important to you they are, and the more time you spend with them, the more intensity there is in the relationship, right? So you're going to be frustrated, you're going to be upset. And that's why really good communication. Not endlessly. You also have to have some enjoyable times and fun. Like you just can't talk. No couple can stand talking about their relationship endlessly. But
And there,
saying, "Look, I regret I did this," or "I'm upset that you did that," and let's figure out how to move past it.
as opposed to being silent.
Silent doesn't work because when you're silent, you're often seething. People know you're mad. I mean, when people say, "Oh, he doesn't know I'm mad," or "She doesn't know I'm mad," it's like, well, I mean, again, I've done plenty of work as a couples therapist. Like, let's get them to come in because
Right.
I bet they know you're mad.
Yeah.
And inevitably they do because you change. Like, we all think we're such good actors and actresses. Ha! We aren't. We're like, people are angry. It's like, and people can only be in trouble for so long.
Right.
And then they're not going to be comfortable in the relationship because they're going to say, "I'm always in trouble. I don't want to live my life in trouble." Gosh, that's a big motivation to forgive, move past, but also not say anything because it's just going to happen again. We
Right.
all are who we are. We have patterns. You have to put energy into changing your behavior patterns.
Mm-hmm. Do you think that most people that can't regret their, what is it because they're afraid? Is it a fear of what the other person, they don't know how the other person is going to react? Is it their own anxiety, or it could be a combination of the
You
two?
mean that they don't talk about it, or they
That
say,
they,
"I don't regret anything. I'm
or
fine
no,
with what I do"?
that they want to regret, they
Yeah.
want to say, but they just can't get themselves to say it.
Yeah,
Or,
I think there are different reasons. I think some people are afraid of the conversation. So
Mhm.
they're the avoidant. And individuals who are anxious, avoidance is a big part of anxiety. I don't know how it's going to go. Oh gosh, it could be a mess. Ooh, let's just not go. So for some people, they're just avoiding it because they don't know how it's going to be emotionally and they're worried about what the reaction will be.
Mhm.
Other people don't examine their behavior that much. There are people that are remarkably clueless about how what they do affects others.
Yes.
So that's a problem. But then sometimes people want to say something and yeah, there's another subset of people that just, I don't know why, but they just can't admit that they're wrong.
That's true. So,
That is really not helpful.
yeah,
I've never done anything wrong and I've never made a mistake. Like, stop it, you have.
yeah, you have for sure. I mean, like you said, everybody has. So what does that say about someone like that? That can't be healthy.
It's not healthy. And often, to be honest, I think it's a burden to people because they often feel like they have to be that they're holding themselves to an unbelievable standard. I
Mhm.
have to, it's not that they're not being unkind, but they really feel like, no, I think I've done the right thing and I'm working really hard and I'm trying really hard. And so what I've done is right. Like, well, maybe, but maybe not.
Mhm.
I mean, this idea that you can be right all the time, that's just so unrealistic.
So it's a feeling that, because you were talking about, regret is an emotion
Mhm,
slash feeling, right?
mhm.
So someone who says, I didn't do anything wrong or whatever, or maybe it's just they don't know how to feel it. Is it
Well, and
possible?
that's
They
why
don't
one of
know how
the
to.
absolutely, because that's one of the steps, right? You have to acknowledge that
Mhm.
you're feeling it. And some people are really good at pushing away negative emotions.
Mhm.
They're uncomfortable, they don't like them, they don't like how they feel when they're having them, so they just, I'm going to ignore that. Right? Most of us can get through, I mean, we get through hard things all the time because we say, I can't think about that right now. I
Right.
can't be focused on that right now. I need to think about something else. I need to be focused on something else. And so, yeah. But if you get really practiced at that, sometimes you just don't want to know how you're feeling. And
So,
people have said that to me. It's like, if I start feeling, I'm afraid there'll be too many feelings. So it's like, okay.
mhm.
So that's where you maybe have to start small with some support, from really close friends or family or
Mhm.
even a counselor.
So what if you can't forgive yourself? You can't forgive yourself you're regretting all kinds of things and you know it. But and even if you say it, a lot of times I know myself when I hear myself saying, "Oh, I'm really sorry I said that," or whatever. But it comes back into your mind then of, okay,
But this is
I
practice.
don't, but I don't forgive myself. Do you have
Well,
to, I
then
guess the question is, you have to forgive yourself.
you
It,
do.
it's got to be the whole thing.
It is the whole thing. And you have to, but that's where CBT, it's not like you challenge an idea once and then it's gone. That would be great, but
Yeah,
that's not
wouldn't
the experience.
that?
That would be great. And I would be thrilled because we could help everybody very quickly. What you have to do is retrain your brain. So the thought comes back and you say again to yourself, I was not trying to upset anyone. I was doing the best I could. But it is repeating those kind of thoughts, challenging those thoughts over and over again that it often takes. But first you have to consider the possibility that you deserve to be forgiven. There are very few things that that are truly unforgivable. And usually they involve, being unspeakably unkind or violent or something like that. But most people are not trying to hurt other people.
Mm-hmm.
They're not. They're not trying to hurt other people. They're trying to do the best they can.
I think I think it's hard to forgive yourself though, right? Wouldn't you
Very
say? And I mean, is there any special, technique or anything like that that, can help you get to that stage besides mind over matter?
well. I think what you have to do is examine your motivation sometimes.
Mm-hmm.
Was I trying to be unkind? No. Did I think that comment was going to generate that response? No. Did I think making this decision would lead to that? No. In that, when you forgive other people, those are all the things you think. I don't think he was trying to upset me. I really don't think it was his plan for me to feel this way. All those things, right? You just have to do the same thing for yourself. But you have to start by saying, it's okay if I forgive myself. I do not have to be in trouble forever.
Right.
I think most people have a much harder time forgiving themselves than forgiving others.
I agree with you with that. I think it's, I mean, just from my own experience, I think it's really hard to
Yep.
forgive yourself, especially
And
your loved ones, I mean, your children or your family, I think it's close friend. I think it's really hard.
much harder.
Yep. So, our next question from Susan,
Mhm.
her question is, so what if you keep reliving the event?
Well, if you keep reliving the event, that will worry me a little bit about has it triggered something like post-traumatic stress. I mean, they're rethinking it and reimagining it because maybe you're trying to think, will it turn out differently this time? Or what did they say? What did I say? Let me think about it. Okay, that's one thing, but sometimes people literally relive it. They feel like they're almost in a movie, that they're back in that moment, they're in the middle of it again.
Mm-hmm.
And that's concerning because that is a symptom that can be part of post-traumatic stress disorder or PTSD that should get proper evaluation and treatment. So it depends. If you're reliving it over and over again, you have to stop that. And what I mean by stop that, it's not that simple, but you have to say, okay, what is going on? So don't relive it by yourself, which is probably what someone's doing. Go talk to someone about it.
Mm-hmm.
Again, maybe that's a professional therapist or counselor or psychiatrist, but maybe it's not. Maybe you're just speaking to someone you trust because you are going to lose perspective. And probably, sometimes there are the things we remember. Like, if you had a great seventh birthday party, you might remember that for a while, but because it was fun. These things, when we relive, we become worse and worse, and we were more and more terrible. And why did you say that? And oh my gosh, I want to grab the words as they come out of my mouth, or I'm going to not do that thing. That's really unhealthy because you're just reinforcing this was terrible, usually. And if you feel like the person did something to you that was negative in that way, you're just going to put up a barrier to being able to move forward in that relationship.
Mhm. Great. You're almost making it bigger than it.
Well, you just, and also, I mean, the brain doesn't, we don't know how the brain works, but I don't think it has space. Like, ooh, because you thought about it 42 times, it takes up this much space. And if you think about it 3 times, it takes up this much space. But emotionally, it does, right? We think about things, and the things we think about a lot are the more emotionally charged. And the things we don't think about that often, you know, you don't think about it.
Yep. True. Great. Our next question with Margaret. She'd like to know, can you talk more about the physical manifestations of regret, about life choices, and how to address these physical manifestations?
Well, the things that have been studied are sort of the non-specific things like stress, muscle tension, et cetera, that go along with all stress states. And we know that when you're in a stress state, essentially you get your sympathetic nervous system, you're in fight or flight. So typically people can have higher blood pressure, they can have a higher heart rate, and there are all the medical consequences of that. So that's what we think about. I also think there's something about, if you're in that kind of a state, are you taking care of yourself? Some people deal with that by drinking more alcohol than is healthy, using other drugs. So there's other fallout where people say, I don't like how I feel. So how about if I turn off my brain for a little bit? And that ends up being potentially a problem too. So what we know about the direct medical consequences are that they essentially put you into a stress state. And so all the things related to that, people stress eat, they're, those kind of things.
Mm-hmm. So maybe try to find,
healthier ways to deal with it.
And it could be even as simple as, you watch maybe it's a movie.
Watch a silly show, go for a walk, pick up, I always tell people if they're stressed, they're waking up in the middle of the night because they're having this, have a book you're enjoying next to your bed that you can read. An actual book is better that doesn't have a bright light going into your eyes because you might actually get back to sleep. But it's 2024, maybe we don't have that, but it's a bunch of those things.
Great. Thank you.
But you have to get we can divert. We're not actually able to think of two things at the same time.
Really?
So if you force your attention on something else, it can switch back and forth. But if you really put your attention on something else, that can be a very, very positive distraction. So favorite movie, a show you're enjoying, calling up a friend and saying, I really want to go for a walk. Right. Physical activity can be really good.
Don't go and put the sad music on.
Don't put the sad music on, and get out the photo album that's going to remind you of whatever terrible thing happened, right?
Right, yeah. Right. Okay, our next.
And I'm sure you shouldn't Google certain things either. Like, I'm sure.
Oh my gosh, I think that's a problem, right? That's huge.
Yep.
Huge. Don't even think about it.
No Googling.
Getting on social media, period, because then you're looking at.
As I mentioned, there's a lot of negative comparisons in regret. If I had done this, then my life would be here, not there, and I'd be more like this person, not this person, et cetera. And for all the information or maybe community that can come from social media, there's a lot of horrible comparison.
Yep.
Because people are so careful about what they put on social media. They don't put their messy kitchen on social media. Based on social media, we will all be at a family reunion or a wedding this weekend. I'm pretty sure.
Yeah.
And everyone will be clean and in spiffy clothes and having a great time.
Exactly. Okay. Our next question from Rashna. I think that's how you pronounce that. What if you keep falling into a pattern of regret? And her second part is you keep taking action and then regretting it again and again. What should one do? And you touched on that a little bit earlier.
I think you need to speak with somebody, either a trusted advisor or someone, to say, why do I keep doing the same thing over and over again? Because sometimes people keep doing the same thing because the alternative they're avoiding the alternative, or they're uncomfortable with the alternative, or they're not even seeing alternatives. But that's concerning when you're in a pattern, because then you just keep saying, I really have to stop doing this. Like, well, okay, how are you going to stop doing this? Oh, I don't know. No, you
Right.
have to talk through. And there, the specifics, which aren't appropriate for this discussion, but the specifics of what are you doing over and over again and what do you need to change are pretty important for making an action plan.
Mhm. Thank you. So Bella is the next question up.
Mhm.
And she'd like to know, what's the relationship between regret and failure at weight loss? It's a good
I
question.
don't know of studies. What I would imagine is that people are remarkably unkind to themselves, but also, you know, I've had people that I've worked with professionally that are trying to work on that, and they're often so hard on themselves that if they don't follow their plan, they say, forget it, as opposed to, well, let me see if I do better at dinner, or let me try to do better tomorrow. And so I do think there's that pattern of having really rigid, unrealistic expectations that just fall apart because they would fall apart. The other thing I will say is that with depression, particularly, but also anxiety and some other conditions, sometimes people, when they feel awful, food is comforting. So then you wonder, is something else going on where that is a way to just feel better? And it's healthier if you feel better if you take a walk or you do something else. But that we're human.
Right. We're going back. You go
And
back to your go-to pattern.
you
And you
do.
have
And
it.
the truth
Yeah.
is, when you're upset in that way, people are not going to say, let me get a bag of carrots, because that's going to, that is not
I
going to
know I
happen.
don't, Dr. Schwartz. I know
I do
don't
not
say I'm
either.
going to go get a bag of carrots.
No, you're not going to get a bag of carrots.
No, no. I'm
A
going for
Milano cookie, maybe, but not a
yeah,
bag of carrots.
yeah. I'm going for the peanut M&Ms personally. But
Right.
um, okay. Sylvia has a question. And she says, so what do you do if you apologize to someone and that person refuses to accept your apology? Then you feel worse than ever, and the mistake you made was really unforgivable.
No,
Boy,
you can't decide. I
wow.
mean, sometimes the person refuses to accept your apology because of something going on with them.
Mm,
Right. I think you have to, then if I were working with someone, I said, look, you've done what you can do. You've apologized, and you've thought about this, and you know how you're going to break this pattern. So this isn't going to happen in other relationships or other friendships, or at work again, depending on what you regret. But we can't ask other people to be reasonable. That's my experience. Sometimes people just aren't reasonable, or they're in themselves in such a bad spot that they can't have a reasonable dialogue with you. You
mm,
can only control yourself. And then
mhm.
if they don't look, that person, the example I gave from work, that person, I didn't have to work with that many more years, and I was relieved because we could never really get good communication. And then I found out I was not the only one. And
Mhm.
so it's like, okay. And okay. But at least I didn't, it's like, oh, this is what the person's doing with everyone. Okay. But if you apologize, you've done what you can do. I'm a
Mhm.
big believer in that. If you've done everything you can do, well, then you have to let it, you have to work on letting it go. And that is often a process of talking through why it's not your fault and why it's time to, move forward.
Right. And I think too, it's,
But that's forgiving yourself too, right? I've done what I've
right.
done. I've told them why I'm going to not do this in the future. That's about forgiving yourself.
And do you think it's also too, besides forgiving yourself, I mean, everyone wants to be liked, I mean,
Of
that's
course.
the other side of it, right? And that not everybody's going to like you, but it's that
Do I?
feeling. Yeah, yeah.
No, I mean, exactly. We're
Right.
all uncomfortable with that. We're all
Yeah.
uncomfortable with that.
And that puts you back in that to Vicky, back to, I'm sorry, to Sylvia's question, that when the person then doesn't accept your apology and all of that, I mean, and then you really feel bad about yourself and that whole thing, but you explained it well, but it can be a vicious cycle, really.
It can be a very vicious cycle. And the problem with that vicious cycle is that you only have control over part of it. So that's what I ask people to do. Let's focus on what you can do.
Mm-hmm.
And if the person's unreasonable, I mean, sometimes the conflict happens because the other person is being pretty unreasonable too. You can recognize your own part. You can apologize for your part, but it could be that, it usually takes two.
Correct.
And if they're not prepared to have that kind of communication, there really isn't a lot you can do sometimes.
Mm-hmm. Well, Vicky has a question. She had a friend from a long time ago, and then the friend kind of withdrew from her, and it's been very painful. Many, many, many years have passed, and she still can't get over the pain. So, how do you get over that when someone is?
I think that's tricky, and I think it's tricky because probably there are probably details that aren't appropriate for us to talk about here about what happened that's still holding such a long time. I know some people, actually, I know some good friends from school where two of them had a falling out, and the other one years later wrote a letter saying, I want to explain why I wasn't a very good friend then, I wasn't available, and and maybe you'll accept my apology or not. She called me up and said the same thing, but I like to focus on forgiveness. I said, I get it. I knew a lot must have been going on. I wasn't taking it personally.
Mm-hmm.
Right? That's the point. You can't control that other person's reaction.
Yeah, I think that's such a hard thing to do.
Of course it is. We want control. We want to take it personally. Well, it's about me. How's that not personal?
Mm-hmm. Mm-hmm.
Because if it's not personal, then it's out of our control and not about us. And that's pretty uncomfortable.
Can you sort of think of regret in a way like okay, I'm feeling it, and if I apologize, this basically you've been agonizing over it.
Mm-hmm.
But then eventually you get to the point where you say, okay, I'm gonna apologize. Does that sort of like quote like erase the regret? Or can it?
I actually think that, well, if the apology includes, and this is how I'm going to handle it differently,
Mm-hmm.
the last part, which is I'm behaving differently, is really pretty important. Because otherwise, like, I'm so sorry. Oh, I did it again. I'm so sorry. I did it again. Like that has no power. Like, once you keep doing something and there's not a change in how you're behaving, then
yeah, you don't really mean it.
You don't mean it. You're just doing it for theater. And then people will say, oh, no, thank you.
Yep. Can regret ever serve as a positive factor?
I think it does when it allows you to reflect on your own actions, your own decision-making process. Perhaps you are too anxious to try something new and you regret that you didn't do it. So I think if you couple the regret with some reflection and trying to understand yourself better, then I think it can be positive.
Mm-hmm.
I think holding on to it and letting it define you is not positive.
Right. Yeah. I think that's really, I think, for most people, including myself in this, I mean, you really talked about a lot of things here, because it's like I said, regret, anxiety, depression, all of this kind of just can be this ruminating, all of it. But
they all share being negative emotions that are painful and we want to minimize for people.
So would you say then probably the biggest thing people need to think of would be what?
I think the biggest thing is if you regret something, think about what you can learn from it. Mm-hmm. And have a conversation, if you're able, with the person that you feel that, was affected by it. And maybe that's you. I regret that I'm too nervous to take on new opportunities. Let me see how I'm going to do that differently in the future.
Right. Good point. Well, listen, Dr. Swartz, we are almost at the 8:00 hour. So I want to thank you so much for speaking with us tonight. And in the coming weeks, a video of tonight's live stream will be available on the A Women's Journey website, hopkinsmedicine.org/A Woman's Journey, under videos on demand. And if you've enjoyed listening to Dr. Swartz and live in the Baltimore, Washington area, there is still time to register for this Friday's May 17th in-person event, where Dr. Swartz will be providing a lecture on mental health. The program also will feature other Johns Hopkins faculty speaking about the rise of lung cancer in people who have never smoked and the risks and benefits of caffeine. So please register online by going to hopkinsmedicine.org/a woman's journey. I sure hope to see you there. To rewatch or share a video of tonight's program, visit the A Woman's Journey website, hopkinsmedicine.org/a woman's journey. And please check out our website for more information about upcoming live programs, webinars, podcasts, and our monthly emails. Thank you, good night, and stay well.